Your dog jumps onto the couch, puts its face inches from yours, and releases a warm cloud of breath that smells like kibble, old socks, and a decision you would rather not investigate. The immediate question is obvious: is this merely unpleasant, or can a dog's breath actually harm a person? For most healthy people living with a healthy dog, ordinary exhaled breath is not considered a dangerous exposure. The smell may be powerful enough to make you reconsider the entire relationship, but odor alone usually does not mean you are inhaling something toxic. The more useful answer, however, has three parts. First, bad breath can reveal a health problem in the dog. Second, saliva is more important than the air coming from the dog's lungs. And third, some people can react to proteins from dogs even when there is no infection at all. So the real issue is not simply, how bad does the breath smell? It is, what is causing the smell, what actually touched you, and who was exposed. Let's begin with the smell itself. Dog breath contains moisture and odor-producing molecules from the mouth, food, bacteria, and whatever your dog recently decided counted as a snack. At normal household exposure levels, these odors are mainly a comfort problem, not a poison. A very strong smell might make a sensitive person feel nauseated or trigger a gag reflex. That is a reaction to an unpleasant odor, not evidence that the dog has released a dangerous gas. But persistent bad breath should not automatically be dismissed as normal dog breath. A healthy dog's mouth does not need to smell like mint toothpaste. Dogs are not preparing for a job interview. Still, a strong, rotten, unusually sweet, metallic, or suddenly different odor may be a clue that something has changed. Dental disease is one of the most common explanations. Plaque and bacteria collect around the teeth and gums. The gums may become inflamed. Infection can develop below the gum line, where an owner cannot easily see it. A broken tooth, an object stuck in the mouth, or damaged oral tissue may also create odor. This is the first important correction: the smell is often more dangerous to the dog than it is to the person smelling it. Bad breath can accompany pain, even when the dog continues eating. Dogs are impressively talented at acting normal while something hurts. If the odor persists, or appears with red or bleeding gums, drooling, difficulty chewing, loose teeth, facial swelling, reduced appetite, or pawing at the mouth, the dog should be examined by a veterinarian. The smell is a signal. It is not the weapon. Now we get to the part that matters more for human health: saliva. Dogs naturally carry many microorganisms in their mouths, just as humans do. Calling one species' mouth cleaner than another is not very helpful. They contain different microbial communities, and neither mouth is a sterile operating room. Most people touch dogs, get an occasional lick, and never become ill. But risk changes when saliva reaches an entry point. Intact skin works like a wall. A lick on healthy, unbroken skin is generally far less concerning than saliva entering a cut, sore, bite wound, eye, nose, or mouth. One bacterium that illustrates this difference is Capnocytophaga. These bacteria are commonly found in the mouths of dogs and cats. Human infection is rare, but it can become serious, particularly when bacteria enter through a bite or when saliva contacts an open wound. The people at higher risk include those with weakened immune systems, people without a functioning spleen, and some people with certain chronic illnesses or alcohol use disorders. That does not mean every dog lick is an emergency. It means the route of contact matters. Dog breathing near your hand is not the same event as dog saliva entering a fresh surgical wound. A quick lick on intact skin is not the same event as a bite that breaks the skin. And a healthy adult is not always in the same risk category as someone receiving chemotherapy. This is why dramatic stories about rare infections can be misleading when they leave out the entry point and the person's medical risk factors. The infection may be real and severe, while the everyday risk for most dog owners remains low. A sensible household rule is simple: do not encourage dogs to lick open wounds, irritated skin, or medical devices. Avoid letting them lick directly around your eyes or inside your mouth. Wash your hands before eating, especially after handling pet waste, food bowls, raw pet food, or anything your dog proudly recovered from the yard. And despite the enthusiastic confidence of the dog, licking is not medical wound care. What about rabies? This is where people sometimes become frightened by a dog merely breathing near them. Rabies is transmitted through infectious saliva, usually from a bite, scratch, or direct contamination of broken skin or mucous membranes such as the eyes or mouth. Simply smelling the breath of a normal dog is not the same as receiving saliva into a vulnerable entry point. Even a lick on intact skin is classified differently from saliva contacting broken skin. But rabies is not a disease to evaluate casually after a real exposure. Risk depends on the animal, its behavior and vaccination history, whether the skin was broken, the geographic location, and whether the animal can be observed or tested. If an unfamiliar, stray, wild-acting, or possibly rabid animal bites or scratches someone, or its saliva clearly reaches an open wound, eye, or mouth, the area should be washed promptly with soap and water, and medical or public health advice should be obtained immediately. Do not wait for symptoms. Rabies prevention works before symptoms begin. That advice applies to a genuine exposure, not simply to a dog exhaling nearby. Now for the third piece, allergies. A person may say, every time the dog gets close to my face, I start sneezing. It must be the breath. Possibly, but the warm air itself may not be the real trigger. Dogs produce allergenic proteins found in their dander, hair, saliva, and urine. Saliva dries on the fur after the dog licks itself. Tiny allergen-containing particles can then spread through the home, settle into furniture, or become part of household dust. So when a dog climbs onto your pillow, you are not being exposed only to one breath. You are meeting an entire portable ecosystem. Dog allergies can cause sneezing, a stuffy or runny nose, itchy or watery eyes, coughing, hives, chest tightness, wheezing, or shortness of breath. A person with asthma may have more serious respiratory symptoms. In that situation, the question is not whether the dog's breath contains poison. The question is whether close contact is delivering allergens to a sensitive person. Keeping the dog out of the bedroom, washing hands after close contact, cleaning soft furnishings, using effective filtration, and speaking with an allergist can help identify and manage the actual trigger. And no, choosing a so-called hypoallergenic dog does not guarantee an allergy-free home. All dogs produce allergens, although individual people may tolerate particular dogs differently. There is another reason to pay attention when a dog's breath suddenly changes. It may occasionally point to a problem beyond the teeth. Certain illnesses, changes in diet, vomiting, or something lodged in the mouth can alter the odor. A veterinarian may need to look at the entire dog rather than merely recommend a breath-freshening product. This matters because products that temporarily cover the smell can hide the warning without fixing the cause. It is the canine version of spraying air freshener beside a smoke alarm. So what should a dog owner actually do? Enjoy your dog. Ordinary affection is not a biohazard exercise. But use a few reasonable boundaries. Do not let the dog lick open wounds or medical sites. Be more careful with face licking when someone is very young, immunocompromised, seriously ill, or has damaged skin. Wash bites and scratches immediately, and seek medical guidance for wounds that break the skin, especially if the person is in a higher risk group. If allergy symptoms appear around dogs, look beyond the breath and consider dander and saliva proteins throughout the environment. And if the dog has persistent or suddenly severe bad breath, treat it as information. Check for other symptoms and arrange a veterinary dental examination instead of trying to win the battle with mint-flavored treats alone. The central answer is reassuring but specific. A healthy dog breathing near a healthy person is usually more socially offensive than medically dangerous. The meaningful risks come from different mechanisms: saliva reaching broken skin or mucous membranes, bites and scratches, uncommon infections in vulnerable people, allergy exposure, and untreated disease inside the dog's mouth. In other words, do not panic about the cloud. Pay attention to the contact, the person, and the dog producing it. The next time your dog yawns directly into your face, you are allowed to move away. That is not fear. That is simply a functioning nose. But if the smell keeps returning, becomes unusually foul, or appears with changes in eating, drooling, swelling, bleeding, or pain, consider it your dog's very impolite way of asking for a dental check. Does your dog have harmless breakfast breath, or the kind that can clear an entire couch? More importantly, has the smell changed recently? That difference may tell you far more than the odor itself.